Joining us now is Mayor Eric Garcetti of Los Angeles, one of the hardest hit cities during this pandemic. Things are looking up these days as both cases and deaths are now on the steep decline. I'm looking forward to hearing from the mayor about the rollout of the vaccine, its equitable distribution, and the road ahead. Mayor Garcetti, it's so great to see you again. Let me just ask you, we're sitting at a time where, I know Los Angeles well, and you have been a mayor very, very committed to reaching the parts of Los Angeles that aren't always at the front of the line when it comes to health outcomes. What are you doing? What's your dashboard look like as you look at the city and as you look at what we're dealing right now with what's still a scarce resource, which is the COVID vaccine?
Well, you're right. It's great to be with you, first of all, Steve, and thank you. Good to be back with you and to talk about this stuff because, for me, from the beginning of this as a mayor, I always used an equity lens to look at how this disease, while it didn't discriminate who it infected, it certainly discriminates how it infects you because of long-standing health disparities. So when we saw, for instance, early African-American deaths in our country be double the represented population in major cities, we in Los Angeles surged testing, messaging, community support in African-American neighborhoods, and we saw that drop down, that if you take that first month away, deaths in the African-American community have actually been lower than the represented population. And we're taking that same knowledge to work in immigrant communities, the Latino community, to look at low-income and high-density communities to bring equity to vaccine distribution. Because if you just put out codes and you just put out information that you can log on with a laptop or a desktop online, those vaccines will always go to the higher education, higher income, less dense, and often less communities of color areas of a city. The early statistics for our county here in LA County showed, for instance, 3.5% of vaccines were going to African Americans, with nearly 10% of the population being Black. Similarly, half the population is Latino, only 23% of those vaccines were going there. So we worked with the county and my firefighters and community-based organizations to take mobile teams into the community. And we've seen, for instance, those mobile teams do 90% people of color vaccines in Black, Latino areas. And it's really the 4 T's, I say. You need to tell the truth to folks. You need trusted messengers, community groups, and clinics that people already know. Then you need the technology and the transportation that really speaks to people who are lower income. Not everybody has a laptop or a desktop, but they do have a mobile phone. Code it and make it easier, especially for those who are technologically challenged or don't have the broadband connection. And then transportation is critical. These mega sites like Dodger Stadium, we stood up the biggest vaccine site in the world at Dodger Stadium, but we need to make sure people get rides there, whether they have a disability, low income. And so we've pooled together our local MTA, Uber, Lyft, Access, which is our paratransit for folks with disabilities. And we're putting together an app that people can just say, need a ride, boom, you can go.
Is that, Mayor, part of the MOVE project, this mobile, I call it the Mobile Outreach for Vaccine Equity Initiative? I mean, maybe you just described it, but I think it sounds cool. So could you double down on that and tell us a little more?
So MOVE is our program to not just have these big sites, not just the pharmacies or your medical provider, but to actually take a mobile site that can set up in, a parking lot in a high density, low income area of our city. And we walk door to door. We work with trusted community groups, give tickets out, and make sure that people from those communities, not people driving across town, are getting those vaccines. We started one in South Los Angeles. 77% of those were given to Black Angelenos, over 90% to people of color. Then we moved to another one in South LA, the east side of our city, which is the heavily Latino heartland, our San Fernando Valley. And we're going to have 10 of these, the equivalent really of a mega site, but on wheels. And we'll come back, 3 or 4 weeks later for your second dose. And this is really showing a model that we shared with the White House, other mayors. And I've talked to mayors like Mayor Durkin up in Seattle that's doing the same thing. And the national, mega sites that are being put together by FEMA and the Department of Defense now include also mobile teams so that people who can't get to the mega sites can have those vaccines come to a parking lot, corner near them.
One of the things, this is a little off script perhaps, I love Mayor Durkin in Seattle, and you're all struggling with how to do good for a lot of people. But there are some people out there that are suspicious. They may, have some anxiety about what's going on. We've seen some protests outside Dodger Stadium of people concerned about this vaccine. I guess my question to you is, I know the mission is to vaccinate everyone. I also know that your mission as a great leading mayor in the world is to work on things like climate change. I just am interested in how you overcome people's doubts, how you bridge that so that people are willing to do what whether there's something left tomorrow when we have the next pandemic, when we have to make hard choices about climate change, how you can kind of overcome some of these that are resisting this because they don't trust government.
Well, I think that's, the distrust of institutions, not just government, whether it's media, government, business, religious institutions, some of our main ones that always pulled over 50%, like law enforcement, which is now less so. This is a trend nationally. And to me, the best lesson I ever got was from my predecessor on the city council, who, when I became a city council member, she told me, you can't dismiss people's fears. You have to understand them. Now, there's some people you'll never convince. It's very difficult for me to unwind somebody's conspiracy theory. But the majority of people are not conspiracy theorists. They're doubters. They have reason to distrust, and they have mistrusted in the past. So when you have to listen to why people, for instance, the African-American community, can go back to Tuskegee, can go back to experiments that were done, the medical profession has to earn that trust every single day. But when you can let them know that an African-American woman helped create the vaccine, and you can name her and point to it, when you can go to a neighborhood clinic or even a celebrity that people trust who's getting the vaccine, him or herself, these are ways to change those attitudes. So you can't dismiss people's fears and tell them you're wrong, you're stupid, anything like that. They usually come from a decent place. And then you have to give them the reality. I had my second dose this past Friday. And to me, not only has it been safe, I feel incredibly well protected now. I feel ready to re-enter the world, to hug family members I haven't been able to for a long time, to be able to go to a ball game and get on a flight and do those things that made life beautiful in the coming months. So I think you have to talk very personally to people. You cannot make this about statistics, and you certainly can't say, hey, I'm with the government, I'm here to help. You have to say, look, I'm your neighbor, I'm a human being. Let me tell you my experience, and hopefully you can do the same.
Is the Johnson & Johnson vaccine something that's going to be a game changer for you in terms of distribution? I know we've had Moderna, we've had Pfizer, but you still have had, sort of a massive scramble, for supply, frustration with people trying to kind of, get on websites and line up. Does the J&J push us to the level where there'd be greater comfort in people accessing appointments?
I think it helps in three ways. First of all, it's more supply, and it's starting very small, but it will ramp up quickly with over 100 million doses, 100 million people worth by mid-July is what they've promised. Second, for people who don't like getting shots, it's one and done. And third, it helps us with vulnerable populations. For instance, our unhoused, unsheltered population here in Los Angeles, which numbers about 30,000 people. We can go to a homeless encampment, give somebody, that shot, and not have to worry about coming back for a second shot. We can go into places. This could be great for our youth later on if it's approved for young people, because you don't have to worry about tracking them down or doing it twice. It reduces the logistics. But, we have three phases of this vaccine moment. One right now that we're in is not enough vaccines. That's going to quickly change. Phase two is going to be not enough capacity. We're going to have so many vaccines. The question for every jurisdiction is, do you have the capacity to deliver it and deliver it quickly? And then phase three is going to be not enough people. And to your point earlier, how do you convince those who are skeptical or want to wait? I think those are the three phases we're going to go through. In Los Angeles, we're hustling every day. I'm still going to start a reality show called Vaccine Hunter, because I'm looking for every place. We sent our firefighters to a whole bunch of grocery stores a couple weeks ago, 50 of them, just to get 1,000 extra doses in a single day. But soon, if you just do the math, Johnson & Johnson will help. Together with what Pfizer and Moderna have promised, we will have more vaccinations than there are people in the United States of America. So I hope we can use that to help the rest of the world get inoculated as well. And I think that if we have that capacity built up properly, by midsummer, all the adult population that wants to get a vaccine will have a vaccine and be vaccinated in America.
Mayor, we're just a little over a year now in this national trauma of this pandemic, and we saw the early stories around scrambling for PPE. We saw the stories of, what it took to actually put billions of dollars. And so parts of that story are great. I mean, it's miraculous that we have these vaccine options. I mean, I want to underscore it. Usually takes years You've had it in less than a year coming in. I guess my question to you, as we've moved from one presidential administration, the Trump administration, to the Biden administration, has the experience of the city of Los Angeles changed at all, or is it pretty much continuous from one administration to the next when it comes to the vaccine?
The good part is continuous. I mean, it was the previous administration and this administration that have worked with private sector and researchers to develop this miraculous, pace for vaccines to be developed. That is really a remarkable moment in human history, the fastest ever. And we're lucky to be complaining about whether we're waiting an extra week or an extra month for that dose when a lot of nations don't have it. And in the past, this would have had to burn itself out, killing millions more people. Secondly, there's always committed people that are inside the bureaucracies who are not politicized. But I'll tell you, third, what has changed is that this is no longer weaponized. The partisanship, which there's so much to be proud of that America has done, from the vaccine distribution to some of the work that we've done to help people out when both houses and both parties came together. But there was so much that was weaponized and created partisanship, and so much to be ashamed of. A country that's the richest in the world, that was most prepared, according to the WHO, for a pandemic, has, with just 5% of the population, 20% of the deaths. I don't care who you are or what conspiracy you believe, those deaths don't lie. 20% of the world's deaths from COVID, with just 5% of the population, 4 times higher than what we should have done, and maybe even 10 times higher than a rich country should have had. So there is that marked change with this administration speaking straight science, facts, collaborating with us in an even better way, and not just saying, hey, we did what we could. Now it's up to the cities and the states to figure out the rest, which is a message we got all the time with the previous administration. That is the opposite of what we're hearing now. They said, we're here to help and to stand up sites in your city to help you get what you need, to accelerate vaccines, and to be a partner in helping with the economic assistance directly to our cities as well as to our city's people, which the previous administration almost went to war with.
Eric, let me just ask you finally. I mean, we've had the pleasure of talking a few times over the years, and I've always enjoyed it. I tell people, you're one of America's leading data mayors. I mean, data. You've moved the various divisions of the city into data centers and being familiar. You just talked about reaching people on their cell phones if they don't have, high-speed internet access and whatnot. And I guess I'm interested in the future. That is what we're learning now in reaching communities that have been marginalized, that had not been online, that had not been getting information. Are we going to be more resilient in the future because of this experience? And is LA able to consolidate that in a way from a data perspective?
Absolutely. And I'm so lucky to work with some of the best leaders in this inside my administration and city. Harvard University just honored us for our technology and data work inside the pandemic, and was very moved by that. But we've got to simplify this. If Google can figure out a single login for all the different things we do, why can't a city? And that's what we're moving towards in Los Angeles. Have a single login for whether you're paying your electricity bill, whether you're getting a library renewal, or whether or not you're getting financial assistance from a federal program to help pay your rent. And that same login should help you get a vaccine appointment, should help you with your healthcare needs, should allow you through a mobile device to really get what you need, because the world has already moved that way, but government has been much slower. And we've 3 out of the last 4 years been the top digital city in America, #1 open data city in America. I always say data will set you free and empower people to use it, but simplify it, because most people are on their mobile devices now, and we're still programming like it's 2004, and we're all on a desktop at home with a semi-high-speed broadband connection. That's not how a lot of America lives. And yet, for $50, we saw that story of a young man in New York who took the 5 different appointment systems, coded something, and simplified it for the people of New York. Those are the sorts of people, next generation coders, we should be tapping to simplify and to bring all of city services together to improve people's lives, not just convenience, but sometimes in pandemics like this, literally save their lives as well.
I can't help it. I gotta ask one more.
Sure.
Yeah, I love show and tell with mayors, as you know, and it's just great that you were sharing so many of the things you've done. One of the other cool things you've done, which I'd love that DC to hear about, and New York, midnight vaccine clinics. Do you know about tell us about midnight vaccine clinics?
Sure. We want people to come and get vaccinated however is best for them, whether that's very late hours and kind of a way that people can take it almost as a social event, as a rite of passage, something where hardworking people can come late or young people can come and do that. We're turning our work, whether it's at Dodger Stadium in a mega site or kind of having a more festive environment to come late at night, as you would in the past go out to a date or go meet friends to be able to have your vaccination taken care of. So we're working with local partners to do that. I'll work 24 hours. I'll drive a car to get a vaccine to a certain corner that's underserved. I'll set up the biggest sites in the world. I'll do whatever it takes to make sure my people's lives are restored as quickly as possible. And if you can have a little bit of fun with it, why not?
Well, thank you so much for that, Mayor Eric Garcetti of Los Angeles. I always love talking to you. I mean, I think Los Angeles is one of the greatest cities in the world. It's a real pleasure to see what you're doing and hear what you're doing, in particularly reaching people. And I want to tell everybody, our job today is not to necessarily think about how we reached everybody who's already going to be in line, who's already going to have access. It's really kind of getting beyond that and figuring out how we keep doing that over and over again, and making sure we have an inclusive health system. So, Mayor Garcetti, thanks so much for joining us.
You bet. Always great to be with you. Thank you.
Well, that brings us to the end of our program today. A big thank you to Granicus for its support and all of you attendees for joining us for these conversations today. They've been great. For those of you who missed any of them, we're going to have our video of all these conversations up shortly on our event website at The Hill. I'm Steve Clemons. Stay safe and be well.